Hi guys, if you don't know me, I'm Dr. Boulos. I'm doing aesthetic medicine. We have a beautiful spa in Newmarket, and today I'm gonna talk to you about hyperpigmentation. Many people come, especially after the summer, and they come and they have lots of brown spots. But I just want to say here that not every brown spot is something that we can treat easily, because there is some stubborn condition like melasma, and I'm gonna explain to you the difference after we understand better where we get those pigments. So this is a picture that can show you a cut of our skin. So here we have the superficial layer, it's called epidermis, and we have here a deep layer that's called dermis. This is how we have. I'm gonna try to make it as simple as we can so we can understand it. It's not really medical, but I wanna still stay with the medical facts. So there is some cells here in this area, okay, that's called melanocytes. And those melanocytes, they have some kind of arms, and those arms, they send the melanin. The melanin is the brown pigment. So this is why we get the pigments when the melanocytes are activated under any kind of stress, genetics, sun exposure. It can be pregnancy, it can be certain medication. So it goes, or it can be, by the way, it can be laser and light as well. So this melanocytes, okay, start to send those melanin pigments, and those melanin pigments start deposited here in the superficial part, which is called epidermis. So I'm gonna just make another drawing here in this little paper to make you better understand it. So this is the epidermis. That's what I could pen. So this is the epidermis, and here we have the dermis. Okay, now I'm gonna try to use another color. So those are the melanocytes, and they have those arms, and they are sending those melanin here. But the problem here is, if we have the melanocytes sending those melanin pigments in the dermis, not in the epidermis, because if it's superficial, I can easily get rid of it, and we're gonna talk about how we can get rid of it. But if it is deep down here, and if I have continuous signals going here, and nothing will stop them from keep sending those brown things, then the problem is chronic. And this is what makes the plasma condition more difficult to treat than just normal sunspots, because it's continuous problem. It's a chronic thing that those cells, they keep sending, those melanin pigments. So I need to tell them, you know what, you're super active here and you're causing me lots of problem when you're doing that, so can you please stop doing this? And this is how we're gonna explain it. So simply speaking, if we have the brown spots here, I can treat it by IPL if you are a candidate. And again, as we mentioned in a previous video, that IPL is good for skin type 1 to 3. I can prepare your skin by using some good products before I do the IPL, so I make sure that I am not having any more coming here, even under the effect of the IPL rays. So we can do that. We can do continuous chemical peels, and peels are great. We have Jasmine peels, we have TCA peels. They are amazing. If we take a layer here, I can get rid of it. But again, I have to make sure that nothing is coming. So the other thing is, as we mentioned, there is two things I have to do. I have to cut those things from happening, which is called the tyrosinase inhibitors, which is the hydroquinone that exists in our medical graded products. So I can just use those kind of serums, which can make them stop sending anything to the surface one more time. Also, what I can do is I can use some kind of lasers here, not IPL, but they are Q switch lasers or Pico lasers, which can, cauterize those ending here, so it doesn't send anymore here. That's a good permanent solutions for those things to stop coming to the surface. So I hope this is not complicated, but products. What can I use for products? My first choice here is hydroquinone serums. Also, retinols are great because, as we mentioned before, that retinols are great in helping the cells turnover. So if your cells turnover happens every 30 days, the retinols help the cells turnover to happen every 18 to 21 days, which is meaning that this is out and new skin is coming out, which helps acne, which helps fine lines, which helps the pigmentation. So I love vitamin A's, I love retinols at night. And the other thing we talked about is hydroquinone, which is it does cut the communication here. And again, I'm talking about laser, which is more radical down to the surface. However, to keep controlling this one, the most important thing that we have to do is prevention. So when I say prevention, why do I have to go through this thing to treat it? I don't want to have it from the beginning. So for this, your best option, your best product, your good anti-aging product is a sunscreen, which we're gonna talk about it later. But sunscreens, and I would encourage you also to use vitamin C, because vitamin C as well, it's sun protection, is anti-aging. So in the morning, please make sure that you're wearing your sunscreen and your vitamin C, because this is how you control no further trauma that can cause those melanocytes to be more active again and to send those melanin pigments to the surface. If you still have any more questions, if you have any personal question, please write it down under this video and I'll be more than happy. I'm always in my phone and I can answer your questions either in Facebook or on Instagram. We're happy to answer your questions. Also, you're so welcome to come here for consultation. We have a beautiful machine that can analyze your skin to tell me how deep is your pigments and how can we treat it. So it's Dr. Boulos from Newmarket, 905-868-8000. Hope this video was helpful to you. Please share. Maybe somebody else needs to understand this.